I'm Charles Bankhead of MedPage Today. I'm at the American Society for Therapeutic Radiology and Oncology meeting in Boston, where I'm speaking with Dr. Matthew Katz of Saints Medical Center in Lowell, Massachusetts. At the ASTRO meeting, Dr. Katz discussed the development of CAP Calculator, an internet-based risk assessment tool that can help physicians counsel prostate cancer patients about their condition and treatment options. Dr. Katz, could you tell us a little about the background of this program and how it differs from a clinical nomogram?
Sure. Well, I think in terms of trying to decide how to approach the treatment of prostate cancer, one of the important things is deciding the likelihood of the possibility that the tumor spread outside of the prostate itself, either to the seminal vesicles or lymph nodes, and how that might influence treatment decisions, but then also comparing radiation to surgery. And the results can be very similar. The treatment outcomes can be similar, but individualizing and personalizing the outcomes is often very difficult. Nomograms can be very helpful, and Michael Katz, who's done a lot of this research at Memorial Sloan Kettering and Cleveland Clinic, has really helped revolutionize the field in terms of identifying ways to really individualize that treatment. However, it's only from the institutions from which that study has been done that really sometimes may or may not apply to other patients. So the purpose of CAP Calculator really was to design something that would incorporate other predictive models and include them so that it would be an information resource that aggregated clinical research on prostate cancer so that people could look at multiple outcomes at once rather than just one set of studies. And I think, nomograms have been very good at that, but nonetheless, it is only one group of patients and doesn't really necessarily apply to all patients potentially. So the purpose of CAP Calculator was really to increase the ability of physicians who access CAP Calculator to have an information resource to discuss with patients and educate them about the pros and cons of different approaches to treatment.
Where does the program stand in terms of its development and evaluation?
Currently, it has not been tested in a clinical trial or in any format where we've proven what our purpose is. The real purpose is to show that this will help patients feel more comfortable with the decision that they've arrived at and feel that their relationship is better with their doctor and really improve the outcomes, because often with surgery and radiation, if the cancer outcomes are equal, a lot of the decisions between these treatments are which side effect profile fits patients better. And I think the more information that patients have, as long as it's presented in the right context by someone that understands prostate cancer, I think it's to the benefit of patients and doctors alike.
Doctors and nurses can register to use the program at the website www.capcalculator.org. From the ASTRO meeting in Boston, I'm Charles Bankhead, MedPage Today.